Joining us once again, we're still continuing our education on Ebola, and we know that it's a pandemic that has ravaged countries in West Africa and put a lot more others on the alert. And others also, not only on the continent, but the rest of the world, have also made sure they've continued their collaborations with the World Health Organizations and their public health systems in their respective countries to ensure they nip it in the bud. Well, we'll see what efforts Ghana is making so far. We have with us Dr. Chey Farid. He is a Deputy Director for Public Health, the Ghana Health Service, and also a member of the National Technical Coordinating Committee that is particularly looking at the subject of Ebola. Should we be alarmed or not? Should we be alarmed, Dr. Chey Farid? Thanks for joining me.
Thank you very much, my brother. And let me say that it is good on your side to raise awareness on Ebola and to bring to the attention of Ghanaians the need for every one of us to be concerned, but not to be scared. To be concerned means that you have to talk about it, you have to talk about the right things about it, you have to take steps to make sure you do not get it. If somebody has symptoms that seem to suggest Ebola, you need to encourage the person to seek attention or assist the person to seek attention. And then you don't have to be scared, because scare generates fear. And when you fear, then you cannot hear well, you cannot see well, and you cannot act well. And in Ebola, a disease that actually can kill if you don't seek care early, if you do not hear well and behave well, then definitely there's a problem. So Ghanaians don't have to be scared, but we have to be very much concerned, particularly health professionals. Whoever gets the disease, it will be attended to by health professionals. And health professionals must position ourselves in such a way that we can give encouragement to the community, we can give the right information to them, we can work with them to detect cases if they do happen, and we should put in place systems that will allow cases that are suspected to come to the facilities to be confirmed. So since the Ebola issue started and spread to many of the West African countries, Liberia, Sierra Leone, Guinea, Nigeria, as far back as March, Ghana prepared its Ebola preparedness and response plan and set up the National Technical Coordinating Committee, NTCC. And it is the NTCC plan that is currently being rolled out. How is it being rolled out? The plan is being rolled out making sure that if people outside Ghana or anybody outside Ghana has the disease, the person will not bring it inside. And we are approaching this in 3 forms. And everybody has a role to play in this. The first level is making sure that those who are coming from Kotoka International Airport do not bring the disease. And there, the airport authorities are doing so well. We have worked with them, and there's a screening taking place at the moment. The screening makes use of a form. Currently, we are printing the hard copies that can be on board for people to fill on board before they arrive in Ghana. But currently, it is short paper you fill. They're also using a non-touch device that can take your temperature, and if it's higher than we expect, then that person will be sent to a certain room where blood will be taken for confirmation. At the points of entry, we have designated 14 of them, where port health officers are checking, and they also are keeping vigilance. There are some challenges. There are a lot of ports that we do not have, that are not approved. So people are coming through that. And I'm sure the national security is taking steps to make sure that those unapproved entry points are protected. Again, those coming from Liberia, Sierra Leone that are coming by sea and will be coming by boat. The discussion is that those districts that are along the coast, the chiefs and the elders there, working with the health professionals, must make sure that whoever arrives there and complains of feeling hot, which we say fever, and is either coughing, having diarrhea, vomiting, or bleeding, such people should be asked to seek care as early as possible. And if the person is failing to do so, they should notify the nearest health facility that there is a case like this in a certain house and the person is failing to seek care. That is preventing the disease from coming into the country. If somebody in Ghana gets the disease, we are saying that it will start as if it's malaria. It will start as if it's typhoid, because your temperature will be high, you feel hot, then you get headache, you generally feel sick, and then you vomit, you have diarrhea. By the time you see blood, either the blood is coming from your nose, your mouth, or any part of your body, or you urinate and there's blood in it, by the time you see that, it's getting worse. And most of the people who have died in the other countries where the disease is now, is because most of them do not seek early care. And then, for those who are in the hospitals and health centers, we are telling them that, and it's their responsibility, we are telling them that if somebody comes with these symptoms and you suspect Ebola, do not refer the patient and do not let the person go home. Isolate the person in a room and then put on what we call personal protective equipment, PPE. When you put it on, it protects you from getting the disease, assuming the person has it.
That is a health professional.
The health professional. So whether it's a private hospital, a Czech hospital, a Muslim hospital, government or quasi-government hospital, if somebody comes and you suspect that this could be Ebola, then keep the person in a room and arrange for blood specimen to be taken. And then it is shipped to Noguchi, where the test will be done. When the test is done and it is negative, then we release the person to go. At the time the person is in that room, you ask the question, assuming this were not Ebola, what disease could it have been? Assuming you say it could have been malaria, then do malaria tests.
Okay. Now there's a subject about wearing the protective clothes, and these meaningfully are for the health professionals.
Yes.
Just on Wednesday, it was announced by the communications minister that the president had given a directive for, so to speak, some 6 million Ghana cedis again to be used for the whole fight, purchase of protective equipment, etc. Do you think that currently we have enough around Africa, or the supply point, for us to get enough for our health professionals?
I can say for now that those personal protective equipment are key in a health professional deciding to attend to Ebola case. Should we confirm that?
So that we can get the supply.
Currently, as I'm speaking to you, every regional health directorate has been supplied with a certain quantity.
At least.
It is not enough.
At least give us numbers.
Every regional health directorate now has the Ebola specific. We have some PPEs you can use to take the blood. But if a case is confirmed, then what you must put on, we will call that Ebola specific. Every regional health directorate is holding at least 40 now. And the 10,000, in fact, we have estimated that we will require about 15 to 20,000. 10,000 has already been ordered to come to Ghana.
We do understand those points. But the critical point for many Ghanaians, especially in outskirts of urban communities, those people or inhabitants who live in border points. And we're told that these are the communities that also don't have adequate public health facilities. What happens if unsuspiciously we have cases?
Sure, definitely, most likely, the disease Ebola could enter Ghana through those border points, and they could also come through the coastal communities as they come by boat. That is why the regional directors of health services in Ghana, when we met them 3 days ago in Kumasi, we asked them to give us the inventory. They have taken inventory of all the communities that are along the coast and the communities that are near the entry points, and look at the relationship between them and the closest health facilities. And we have asked that they provide their telephone numbers, the telephone numbers of those who work in those health facilities to the community leaders. So if they observe somebody who has symptoms that suggest Ebola and is not reporting, they will immediately notify the health facility.
So all these that you've said preceding this very statement are being undertaken. The monitoring has been done. And
sure, they already have inventory of that, but we have not collected that at the headquarters level. So when we met with them, we said, look, we want to be able to speak to the communities and be able to say that community A, B, C, D, these communities are linked to this post, and that this facility here is where they should call someone if they suspect Ebola case.
A week or two ago, some public health professionals, and especially specialists at even major hospitals in the country, had expressed worry about the unpreparedness of their facilities or even many other facilities to receive cases in case of any emergency at all. Can you confidently say that, well, if you should have any suspicious confirmed case today, that any public health, major public health facility is ready for containment, and where those cases will be quarantined and all the necessary medical or public health measures that need to be undertaken?
Good. Confidence has to do with your level of fear.
On whose part?
On the part of the health professional. The lower your fear, the higher your confidence.
So you're saying those utterances have fears?
I have not said so.
Okay.
I said confidence has inverse relation to your fear. And what are the fears of health professionals? If I do not have PPE, I will fear because I am not ready to go attend to Ebola case. If I do not know how to even manage the case, I'm not trained, I'm not going to attend to the case. If I do not know where to refer to, I will still fear. Even if I have all, but I do not have incentive to attend to the case, I will have the fear. So these expressed fears or concerns are legitimate, and we have collective responsibility to address that. No one person has all the answers. So for instance, the PPE, the orders is in 10,000. Okay, that is good. For the isolation sites, many health workers thought initially that the 3 isolation centers that we are setting up in the southern zone, middle zone, and northern zone to be located in Tema, Kumasi, and Tamale, these zones were going to be the size that all cases would be sent to.
But that's not the case?
Now the understanding that has gone to them is that the letter that was sent to them more than 3 months ago is what is still holding.
Which is? Every
region is supposed to have its isolation center or centers.
Do we have
and in Volta region, for instance, when we met...
Do we have the isolation centers?
Yes, we do.
In each region?
Every region has.
In Accra, where is it?
If any region comes up and say that I do not have, then the regional director of health services will have to explain to Ghanaians
well, we do understand that. The point is that in many cases where we've had precedents, some of these have manifested in which the facilities have not been available and the excuses have been going from one person to the other. This one, everybody thinks that we don't have to belittle it, we have to take it more serious, and indeed you are taking it more serious than usual. Would you say that in each region you can say for a fact that we have the containment or quarantine or isolation centers?
That is where I will urge you to take your camera.
So Greater Accra, where do we go?
You take the camera and then move to each regional director.
To show us?
Yes, and then you take pictures of that and then you show to Ghanaians. When we met, our understanding, for instance, if you take Volta region, look at how long the region is. They have Jasikai, they have Hohoi, they have Pando. So these are the 3 sites in Volta region that are their isolation centers, given the nature of the region. If you take Central region, Winneba Hospital and Cape Coast Regional Hospital, the 2 have the isolation centers. Nobody is to take Kolebu Teaching Hospital to have isolation center. Okay. And Kolebu Teaching Hospital will have no excuse to say that I do not have the center. Komfanoche has no excuse to do that. Ashanti region, Kumasi South Hospital is the isolation center. So these centers are there. And I will urge you to take your camera there and then go around and take some of the pictures and interview them. And where they think they have challenges, they can discuss with you for Ghanaians to hear.
We are not doing our work adequately.
I have not said so.
Now, more importantly, you know that we've had border points, and early on you were talking about where likely some of the cases could come from because of what we've seen in the respective countries where we've had major outbreaks, like in Liberia, in Sierra Leone, and in Guinea, where they come from the villages and the forest areas, etc. Now, we've had reports that we have fisher folks who perhaps also may have been residing or plying the trade somewhere in Liberia, along the coast of Guinea, Sierra Leone, etc. Now they enter through these, they are approved, but unapproved entry points, or unauthorized entry points, so to speak. They are not checked. They enter and mingle in their communities. They interact freely with their families and friends. And you have no fears that there could be likely outbreaks there.
You see, Ebola is a disease that really kills. And it's a disease that is very contagious. It's a disease that you get because you have touched somebody who has the disease, or you have touched somebody who has contaminated something that you have touched. And when you touch the person or touch something that the person who has the disease has contaminated, it means the germs have left the person's body through sweat, saliva, urine, stool, blood, to get into the article that has been contaminated. That means that if the person doesn't take responsibility to make sure that if he's coming from Liberia and he knows when in Liberia there were people there with the disease, and maybe he or she is even fleeing the disease, then you reach Ghana, your temperature is up, you are vomiting, you have diarrhea, then you go mix up with your family. The person has failed to be responsible.
Well, it doesn't
matter. In Ghana, it matters so much.
Well, it doesn't matter.
It matters. No, well, let him come. It matters so much because Ghana, there's evidence that we know a Ghanaian who traveled to Liberia and came to Ghana. Before he landed, he thought that he had headache and fever. He went straight to the port health staff and presented himself. And from there, moved to a private hospital in Accra, presented himself without going home.
Well, we do understand.
And he did quarantine himself.
It's an interesting point.
But that is the point that we want people to...
But Dr. Fari, don't you think that among those very populations, or as far as those demographics...
There are responsible people.
Well, we do understand, but we also know the educational level, the awareness level of those people. And you don't have to compromise in a situation, should you? You don't think that they can act on ignorance? That
is where you are also informing the public.
Where they come through unauthorized routes and they are not monitored.
Because it's not authorized, nobody can monitor. So if the route is not authorized, listen, if the route is not approved, if the route is not authorized, then at the point when they get into contact with Ghanaians, that is the community level. That is where the community level surveillance is very, very important.
Okay.
So if you are in a community and you know that in this community, Liberians do come, Sierra Leoneans do come, who are Ghanaians but residing there, then as soon as they arrive, the chiefs and the elders must take steps to talk to the person that should you develop fever, headache, body pains, or vomiting or having diarrhea, please go to the nearest chief's compound or go to the nearest health center. And that if the person develops something like that, the household members have responsibility to make sure the person goes to the nearest health facility. Once he reaches the health facility, he has been confined in a way. At that point, if it meets the case definition, then they will take blood and keep the person there until the results are back.
Do you think that the public need to be having any phobia at all as far as this very disease is concerned?
No, we should not have fear, but we should be vigilant. We should be vigilant. Vigilant, vigilant, vigilant means making sure that anybody who presents the symptoms I have described is asked to seek medical care. And then number two, people should make sure that as much as possible, they wash their hands with soap and water anytime they interact with people. they should always wash their hands with soap and water. After every interaction, they should wash their hands with soap and water. The church leaders must make sure that they do not call conferences in Ghana that will involve people from the West African sub-region.
Well, they don't.
And that the traditional healers and the churches and the Muslim organizations should not give the impression that they have cure for Ebola, and you should not tell the public that it is an act of God, it's a punishment of God. Ebola is a disease. It's a disease. It's preventable, and if we don't make sure we prevent it and somebody gets it, then the earlier you seek care, the better.
Well, thank you very much. And we've been speaking to Dr. Che Farid. He's a Deputy Director for Public Health, the Ghana Health Service. We've been looking at the subject of Ebola, but more importantly, what steps the Ghana Health Service has been taking over the last couple of weeks, and especially what sort of sensitization and monitoring you're undertaking in communities along Ghana's porous, so to speak, border points. And that's where we bring our conclusion to the subject of today's discussion on Ebola. Now, we go back to the studio. We have a lot more updates for you on the AM show.